Tonight's great debate, will President Obama's plan fix health care in this country? The president gave his old motto new meaning today. Listen.
To those who, here in Washington, who've grown accustomed to sky is falling prognoses and the certainties that we cannot get this done, I have to repeat, revive an old saying we had from the campaign. Yes, we can. We are going to get this done.
And of course, on the other side, you also know what they're saying.
Well, I think when people find out that essentially what they're being given is a choice to have the government direct which doctor they see, whether they can see a doctor, or when they can see a doctor, they're going to turn this down and say, let's get to business solving the problem, and that is covering about 12 million people who don't have coverage, and please leave the rest of us alone.
Enough with the politicians. Let's hear from some doctors right now. In Los Angeles tonight is Dr. Jorge Rodriguez, a board-certified internist who backs the president's plan. Dr. Eric Novak is in Phoenix tonight. He's an orthopedic surgeon and a senior fellow with Americans for Prosperity, which fights against government-controlled health care. We want your opinion, too, so vote by calling the number on the bottom of your screen. First, we're going to have a 30-second opening statement from each doctor. Dr. Rodriguez, will the president's plan fix health care? What do you think?
Well, Campbell, I think that the president's plan is a very good first step towards fixing a health care that is really on the precipice of complete disaster. 46 million Americans are living in this country without health care, and 25 million are suboptimally insured. Now, we know that 50% of the Americans that go into bankruptcy because of medical issues. Therefore, I think we really need to stop looking so much at the economics of healthcare and realize that making Americans healthy is good for everyone, including the economy.
Dr. Novak?
Well, the problem here, of course, is that we don't really know what the president's plan is because he hasn't really shared it with us. But from what we do know, from what's come out of Congress thus far, there's really very little in this that does anything to actually protect the rights of patients and their families to remain in control of their health and health care. And all we've seen essentially are endless trillions of dollars in additional unfunded liabilities in a system that, I would agree with Dr. Rodriguez, can't handle it.
Gentlemen, but let me ask you both, because we are speaking in generalities and fairness here. We don't have a lot of the details, but we do know the basic idea here. And Dr. Rodriguez, what do you say to critics who charge that what we're talking about, what we're debating, is really socialized medicine, that people envision hours of waiting to get into, to get to see a doctor, the rationing of our health care?
Well, what I say is that people are already waiting, people that are uninsured are already waiting hours to see physicians, and not even their own physicians. And secondly, you're speaking to a Cuban American, so if there's anybody that is anti-socialism or anti-communism, it's me. This proposed program does not say that every American has to take this health care. On the contrary, I think it's going to provide much more competition. It provides a health care exchange where the government provides a program, other insurances that qualify can belong to that program, and Americans can choose any health insurance that they want as long as they can afford it.
Dr. Novak, go ahead.
Well, the problem here, of course, is that it's what Dr. Rodriguez is saying. There's nothing, we have seen absolutely no evidence that anything that the president or the Democrat leaders in Congress have proposed will do anything to address the issues that he just mentioned. The president was in Chicago last week speaking to the American Medical Association, where he spoke about the incredible importance of evidence-based medicine. Now, don't we think that before we take away the health care that 250+ million Americans already enjoy and force them or coerce them into a different style system, that there ought to be some actual real evidence that demonstrating that the reforms he's proposing will work?
Well, Dr. Novak, first of all, I don't think that there is time for evidence-based medicine when it comes to health care. I mean, you're talking about 5 to 10 years in the future.
But the president is saying that we need to actually have evidence for care, but there should be evidence that might change the health care for 250 Americans?
what the president, first of all, nobody's insurance has to change at all. So we don't have to change the health care for one American, let alone 250 Americans, unless they choose, and there's no greater choice than to
Dr.
choose
Rodriguez,
to be part of this plan.
You haven't seen the plan, and from what we know about what the president seems to favor, up to 100 million plus people who currently have private insurance might find themselves forced into some kind of a public plan. Now, if
I don't
as an
see how
employer,
anybody
which
can
I
be
am,
forced into anything.
I give it up.
And so am I.
So if I say that it's no longer cost effective for me to be able to have insurance for my employees or myself, my employees are effectively forced out of the system
all right,
and
let
into
me
the
ask
government
you,
system.
let me just interrupt for a second. And Dr. Novak, again, without getting into the specifics, which we don't have all the details on, you heard what Dr. Rodriguez said about the number of bankruptcies, and there's plenty of evidence to suggest this, that 53% or 2/3 of all bankruptcies in this country due to people's medical bills. I mean, it's clear that the current system isn't working. So why not be open to trying this?
Well, first of all, Campbell, the study that showed that claimed to demonstrate the number of bankruptcies due to medical conditions was actually done by people who are the most avowed people in favor of Canadian-style single-payer health care. And a lot of people have disputed that.
So you think the current system is working?
I think the current system has serious flaws. But the question of what's being discussed is the health care that you enjoy, your children enjoy, my children enjoy, is essentially at risk. So what we're saying is that we should throw all of this away because of a plan that might work.
Okay, go ahead,
I think
Dr. Rodriguez.
You know, I think it's very ironic that you say the health care that your children enjoy, the health care that I enjoy, but there are 47 million people and children that don't enjoy any health care whatsoever.
All right, gentlemen.
Now, who is going to protect them?
Very quickly, because we're almost out of time. I do this at the end of every debate, and I'm going to ask you, is there anywhere where you think you can agree, both of you, that we could find a little common ground on this issue, one incremental step that you could both agree on?
Well, listen, I think that we probably both agree that we need more primary care physicians in this country, and we need more gatekeepers that actually take care and prevent the illnesses that drain our medical system. So I think, those physicians, just like teachers, should probably be paid more so that we have more of them.
Dr. Novak?
I guess I wouldn't find common ground there. What I would say is that we need health care reform that is based first and foremost on the rights of patients, and not one that is being driven by the same old entrenched interests that are cutting deals with the White House.
Okay. All right, gentlemen. Appreciate your time tonight. Dr. Rodriguez and Dr. Novak, to you as well.
Thank you very much.
And here's, of course, how you voted in tonight's great debate. 70% say President Obama's plan will fix health care. 30% say no, it won't. This is always not a scientific poll, just a snapshot from our viewers who called in. Tomorrow night's great